April is Head and Neck Cancer Awareness Month. And joining us this morning, Dr. Ravi Patel with Comprehensive Blood and Cancer Center to tell us what we need to know about the deadly disease. Dr. Patel, thank you for coming in. We appreciate it.
Betty.
So what are some of the early warning signs for head and neck cancers?
It's a good question because, we have to pick it up early. If you're a smoker or you drink alcohol, try and cut it down. But if you are, be aware of what's going on in your throat and your mouth, because people who smoke, drink heavy, have a chance of getting head and neck cancer, and you can get an ulcer in the mouth, difficulty swallowing, ear pain. Any of those symptoms are important to just get a good ENT check done.
Okay, so definitely go and check those out. What are some of the treatment options?
Fortunately, we have good options. If it's picked up early, you can remove it. Sometimes removing it is difficult because there's a lot of important blood vessels around here in the neck. So you can use radiation, and a specialized kind of radiation which targets just exactly the tumor. That can be worked out. If it has spread, a lot of new treatments in the form of chemotherapy and immunotherapy can be used also.
And you were talking about who's at risk, and you said people who use alcohol and tobacco. Obviously, I was also seeing men are almost twice as likely as women to get this disease.
Good observation, yes. Men, because you see, men smoke a lot, of course, drink a lot.
It goes back to that tobacco use.
So, yes.
Okay, so how should this cancer be monitored after it's removed or treated?
So important to make sure that you have a very good ENT person who is checking your throat on a regular basis. You can also monitor if it has spread through a variety of images. Many times the PET scan can pick up a lot of activity if new lymph glands are popping up in the neck. So imaging, direct visualization, very important.
Okay.
And also, if you already have been treated and are developing new symptoms, of course, you've got to get that checked out.
Absolutely. And then what about prevention? That's always key, right?
Very, very important. So eating healthy is important, but this is a particular cancer which is so connected with alcohol, smoking, chewing tobacco, that it's important that you try and avoid all of that. If you're doing it, cut it down or do less of it.
What kind of alcohol use are we talking about here?
Generally, heavy drinkers get it. If you have an occasional glass of wine, I'm not encouraging or discouraging that. Occasional glass of wine, socially, it's okay. But if you drink heavy every day, several drinks a day, and you smoke, that makes it a very bad combination.
Those two combined.
Yeah.
All right, Dr. Ravi Patel, thank you so much for coming in this morning. We appreciate you.
Thank you, Betty.